Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local health professionals discussing health topics of importance to local residents. Today we will be talking with Dr. Jeffrey Corey of Coastal Carolina Ear, Nose, and Throat about balloon sinuplasty, a new procedure being offered at Brunswick Community Hospital. Also, we have Mary Fogel, one of the dietitians at Brunswick Community Hospital, speaking with us about nutrition and how to lose those last few pounds before summer. Stay tuned to learn about valuable health topics with Health Watch. Our first guest is Dr. Jeffrey Corey of Coastal Carolina Ear, Nose, and Throat. Welcome, Dr. Corey. It's a pleasure to have you back on the show again.
Thank you.
Now, for those viewers who haven't met you yet, would you share some information about your education and your background with them?
Sure. I originally grew up in Scranton, Pennsylvania, and I did my undergraduate work at the University of Scranton, and then moved to Philadelphia for 9 years, where I did medical school at Philadelphia College of Medicine, and then 5 years at Hahnemann University, and then moved down to Whiteville, North Carolina 4 years ago.
Great. Well, what exactly does an eye, ear, nose, and throat physician do?
It used to be eye, ear, nose, and throat, and then about 10, 15 years ago, the eyes actually got pretty subspecialized, so then we actually separated. But it is one of the oldest specialties, so now we're ear, nose, and throat. And our technical name is otolaryngology, head and neck surgery, facial plastic surgery. So we do quite a bit.
That's a big mouthful.
And it is. And we do general surgery for 3 years, and then we specialize in 3 years for ear, nose, and throat. And we do a wide array of problems, and we deal with kids, so we do tonsils, we take out the adenoids, we place tubes, we deal with kids who have hearing problems, neck masses, kids who have allergies, we deal with them as well, and do sinus surgery and treat them for sinusitis. Regarding the ear, with adults, we deal with chronic ear infections, people who need hearing aids and hearing tests. Nose, obviously, we deal with allergy and sinus issues. Throat, we deal with sleep apnea, patients who are surgical candidates for sleep apnea. We do operate on the nose to straighten out the septum, and operate on the throat to take out the tonsils and tissue in the back of the throat to help them breathe better.
Wow. That's a lot.
It is.
Was there something that inspired you to choose this specialty?
The specialty itself is very intriguing. The anatomy of the head and neck and the ears, nose, and throat is very intriguing, and it's a nice mix of office hours and surgery, and we get to see a wide variety of ages from young to old.
Well, tell us about your practice here in Brunswick County.
Sure. I moved to Whiteville, North Carolina 4 years ago, and I joined Coastal Carolina Ear, Nose, and Throat, and I began to work with Dr. DeMuzio and Dr. Kenyon. We opened up a small satellite office down at Seaside, and we stayed there for approximately 2 to 3 years, and business started to boom. So then we decided to move closer to the hospital when I got on staff at Brunswick, and now we have an office in Charlotte.
Well, today I want to talk to you about sinusitis and that new procedure that I understand you're doing at Brunswick Community Hospital. But first, tell us what sinusitis is.
Sure. I think it's a good idea to explain why we have sinuses and what the sinuses are first. So, the sinuses are holes in the skull, and they're lined with a lining much similar to the lining in our mouth. And that lining has hair cells, and the hair cells basically transport mucus and bacteria that get trapped in the nose out of the sinuses through little holes called ostia, or exit holes. Once in the nose, the bacteria gets swept down to the stomach where we digest it. So that's one purpose of the sinuses. The second purpose is so that it lightens our skull so we're not walking around with a 40-pound head. And also it affects resonation so we can speak louder, more effective resonation. And sinusitis is any type of inflammation that inflames the lining of the sinuses that causes pain and pressure, and that lining that surrounds that hole or ostia gets closed shut, and that causes the symptoms of sinusitis.
And the symptoms are, again?
Pain and pressure over the sinus region, such as the maxillary sinus, the cheek area. Near the nose, that's the ethmoid sinuses, the frontal sinus on top of the skull. It causes pain, congestion, postnasal drip, and in the acute phase, pus, nasal congestion, and occasionally a fever. Once the acute phase is over, some patients experience chronic sinusitis, which is a lingering symptom like postnasal drip or a cough or continued facial pressure.
I understand that sinusitis is one of the most common chronic health problems in the United States. Is that correct?
That is correct.
Wow. What are some of the causes of sinus trouble?
Well, anything that infects the lining and inflames the lining can cause sinusitis. So pollutants, allergies, viral infections, and especially bacterial infections. Some people also have alternate anatomy, where if they've gotten hit in the nose where they're younger and have a deviated septum, which is the midline of the nose, that can crunch the sinuses together and make those holes naturally smaller. So that sets them up for a sinus infection just in case a virus or a bacteria enters, where if it swells slightly enough that it would close off the hole in those patients who have anatomical problems.
Well, you mentioned allergies, and I know I have a lot of allergies. What part does that play in the sinusitis?
Well, an allergy is a response to something that's normal in the environment. So trees are normal, grass is normal, dogs and cats. But in patients who have allergies, they're hypersensitive to these chemicals. So for instance, pollen. If a patient is allergic to pollen, the pollen enters the nose and enters the sinus. And basically the body goes haywire over and tries to wall it off. So the lining gets inflamed, the mucus gets thick, and it tries to trap it. Unfortunately, when it traps it, the lining gets tight again, that hole gets tight, you get pain and pressure, bacterial infection can ensue, and then you have sinusitis.
Joining us now is Mary Fogel, a dietitian at Brunswick Community Hospital. Well, thank you for joining us today, Mary. We're so pleased to have you.
Well, I thank you for having me here.
You're welcome. Well, first off, I'm curious, what inspired you to choose a career in nutrition?
You know, I grew up in an Italian family, and we always ate really good, fresh food, and I just assumed people ate that way. And every time you got sick, you'd go into the garden or you'd make these soups. So I just kind of always believed that good nutrition was the path to good health, and I just followed that as I got older.
That's great. Great story. Tell us a little bit about your background and your education and how you came to work at Brunswick Community Hospital.
Oh, that's a little bit of a long story. But,
is it?
I'll try to cut. Well, I got into nutrition. Like I said, I was always interested in that. So I did nutrition, I did massage therapy, I became an acupuncturist as well, because all those modalities are very interesting to me. But nutrition, I always believed is the pathway to good health, like I said. And I got my degree in Miami, Florida. That's where I pursued my career, and I worked there for many years. And then my husband and I decided it was time to leave South Florida, and we came up here, and I got a position working with Brunswick Hospital.
And how long have you been there, Mary?
I've been here for 6 years.
6 years.
6
Wow,
years.
That's a great story. Yeah. Do you love it here in Brunswick County?
I like it very much.
Yeah, it's a
I
great
like the
place.
hospital. I like being in the small hospitals. It makes it very personal, and it's nice.
It's a great place to live. Well, let's talk about food and nutrition. I've heard a lot about so-called power foods, and how important are they? Are there certain foods that you recommend that we include in our diet regularly?
Okay. Power, well,
I don't
you know
even know what a power food
I know.
is. So
well, I
tell
guess,
me
you
what
know,
that
I
is.
think what people mean when they say power foods are foods that really deliver quite a nutritional impact or punch when you're eating them. And those foods, in general, would be maybe blueberries, blackberries, mangoes, whole wheat products with fiber, things of that nature. And, you know, when we talk about them like that, you don't want to just exclusively think of those as foods, but when you think of food, you just have to incorporate really good fresh fruits and vegetables in your daily life, and you will just naturally have those foods. They'll just be part of what it is that you're eating.
And you should incorporate those into your
You
daily...
should incorporate them into your daily life. You really should. I mean, of everything, of all my years of experience working as a dietitian, one of the things that I found really surprising to me was how few people eat fruits and vegetables in their daily life. It's just not a part of people's daily life. And those are where those power foods are for the most part.
I see. Well, are there foods that we should limit?
Well, and I think, yeah, there are certainly foods that we should limit. And especially in this day and age of food has it's been transformed.
Uh-huh.
Do you know what? I mean, years ago, you used to go into the supermarket, and there were maybe 500 different items in the supermarket, and it was, I don't mean to, you know, walk on any toes or anything like that, but it was real food.
Oh,
it
I know
was,
what you're saying.
it was fruits, it was vegetables, it was bread that was, you know, made out of whole wheat products and things like that. And now we're kind of treading on foods that supermarkets now have like 47,000 different items
Wow.
in supermarkets and things like that. And you look at ingredients, and sometimes you can't even identify what any of that stuff is. So we've kind of gotten away from a lot of what is more natural in our foods, and I think we need to go back to those types of foods.
Yeah. Are there any foods that we should never eat? And please don't say it's chocolate.
Oh, I would never say it's chocolate, Jude. I don't want you to get mad at me. No, actually, they say that chocolate is really good for you.
Oh, good. Then I should be so healthy.
Chocolate is really, it's one of these good foods, and it has antioxidant benefits. However, don't forget that when we do chocolate here, we add a lot of sugar and things like that to our chocolate. Chocolate is fine, and I don't think that there's any food that we should absolutely never have.
Really?
No, because what is it that you should really never have in a food? Food is food. If it's real food, should you limit some foods? Absolutely. Should we just occasionally eat things that are fried, like maybe onion rings that are like 1,100 calories in a serving?
Well, that's like a whole day's worth.
That's just,
Wow.
you wonder why, when you really see the calorie impact of some of these items, you realize why we have some health issues.
All right. Well, I know that nutrition doesn't stop at food, so I assume it covers what we drink also. And I was wondering, how does that affect our overall health?
Are you talking about like things that we drink in general? Well, of course,
Colas,
if you're talking about
soft
soda,
drinks,
I mean, a sweetened soda has somewhere between 10 and 15 teaspoons of sugar per can. And we really are not meant to eat that way. And even juices, I know a lot of times people will, they drink a lot of juices and things like that. And yes, they are natural, and the sugars in them are natural. But if we're really looking to conserve calories, and if we want to be mindful of our weight, we really don't want to be drinking our calories. I just tell people, don't drink your calories. Eat your calories. We like to eat. We like that oral gratification of eating, so eat those calories. Drink, really, the thing that we really need to drink is water. I know people go, I don't like water, but how
I don't
can
like water. Sorry.
Okay. Well, even
Well, how about
flavor.
with those flavors
Yeah.
that you could put in them,
You can
the
flavor.
sugar-free ones? Is that an option? Is that a good option?
It's an option. Well, I'm not crazy about artificial
Sweeteners.
and artificial anything. I like real food. So, but I know a lot of times they're recommended, and they are an option if that's where you choose to.
But the
just to
best thing
go.
is water.
The best thing is water, or even flavor it. Put a spritz of maybe a little bit of orange juice in there, or a little spritz of lemon juice
I
or
never
lime,
thought about
and
that.
things like that.
Just add a little
Just to
bit
add
to
a
the
little
water.
bit, yeah.
I know. Well, you can put fresh lemon, I know, in water.
Well, that's
good.
what I was talking about.
Yeah, that's good. Well, okay,
Yeah.
I can handle that.
Yeah.
I know I am, and I'm sure many of our viewers are looking forward to warmer weather. And in that respect, you know, we're looking at bathing suits and things like that with swimsuit season coming. So are there any small changes that we can make that will help us shed those pounds?
I know, we're always looking forward to shedding those pounds. It's
Yeah,
true.
yeah, right.
And yes, and there are. And I think a lot of times when you ask a person really, what do you think you need to do? They pretty much know what they need to do. But the thing is, certainly there are two things. One of them is exercise. It's really, really important to exercise because it helps us move our metabolism and things like that. It helps us be more, that activity is helpful. Food-wise, if you're not eating fresh fruits, start eating fresh fruits. If you're drinking sodas, stop drinking sodas. Eat smaller portions if you can. And if you're frustrated and you have to eat, because a lot of times we eat when we're frustrated and we're
Right.
stressed. I mean,
Yeah, I
I
do.
always hear people go, "Oh my God, I was so frustrated. I ate that whole half gallon of ice cream."
Yeah,
So
I do that.
it's emotional. A lot of it is emotional. And I think we all do that to a degree because food makes us comfortable, makes us happy, and it makes us feel good. But we ought to have. So we need to shift those items. We need to shift them to maybe raw fruits and vegetables and things of that nature, and not have those other items in the house. Don't
Oh, yeah.
buy them, or buy them in portion control. You know, just buy a little a little can of, or those little tubs of ice cream, or those, you know, little bite-sized candy bars or something like that.